COVID-19 has been spreading quickly. Not only is the virus spreading, but there's also been a wide range of health advice circulating online. What's true and what's not? Formosa News reporter Stephanie Yang asked a doctor about some of the most common claims about the virus.
COVID-19 is spreading fast, as is the disinformation on social media and other platforms. Although social media platforms are taking steps to remove false content, there is still a wide range of health advice circulating online. COVID-19 is often compared to the seasonal flu, and there's been questions raised about whether or not the COVID-19 is less deadly than the flu. Officials estimate the death rate for the virus to be around 3% to 4% globally, while the mortality rate for the seasonal flu is around 0.1%, according to the WHO. Those with COVID-19 will experience symptoms that include a runny nose, cough, sore throat, headache, shortness of breath, and a fever that may last for a few days. It's encouraged that those who have those symptoms consult a doctor through the Taiwan CDC's hotline.
Case fatality ratio, COVID-19 is way higher than regular seasonal flu. Like I say, the seasonal flu's death rate, case fatality rate or ratio is around 0.1% in recent years. But for this COVID-19 disease, now it's around 3.3% or 3.4%. They all start with flu-like symptoms. So that's why we need to screen it and, be aware of this disease around.
Some products are being advertised online as preventive medications for COVID-19. While supplements may be able to boost immunity, Dr. Ho says that supplements are unlikely to lower one's risk of contracting COVID-19.
There are also some, I would say, commercials from some companies that's claiming that their products can prevent coronavirus or simply treat or cure your disease, which are not true right now. The scientists are still researching vaccinations and the antivirus. And before all those legit treatment or vaccinations are published or released, don't just trust random information about those products.
Last month, Hong Kong authorities reported that a dog tested weak positive for COVID-19, sparking fears that pets could pass on the disease to humans. Can you contract COVID-19 from your pet? Dr. Ho says that there is no evidence that pets can pass on the disease to humans, but it is still important to take precautions.
According to American CDC, there is no evidence that pets can spread COVID-19 for now. But no evidence doesn't mean that we don't have to be aware of the possibility. So according to American CDC and my personal recommendation, I would suggest that be careful. If you are diagnosed COVID-19, don't treat your animals, treat your pets like other people. Try not to touch them, try not to pat them, don't cough at them. Take some distance from them.
Face masks are high in demand, but do they protect most people from contracting the virus? Dr. Ho says that standard surgical masks cannot protect you entirely from COVID-19, as they are not designed to block out all the infected agents, but they are still effective to some degree in blocking disease transmission. It is still advised to wear masks in crowded places. However, N95 respirators have been shown to greatly reduce the spread of the virus.
It can block a lot of droplets that you sneeze out or cough out that's flying in the air. So although it's not necessarily blocking all the infecting agents, but it's still effective to some degree that can block the disease transmission. But it's not as good as N95 mask. If you have received any rumors or information that you cannot fact check, then don't spread it. Just wait for several days and see if it's true. Many of them are just rumors or plainly wrong information.
With the amount of information available, the doctor says it's important to look for guidance from the Taiwan CDC, WHO, and local public health authorities, and also to verify online images and videos. Formosa News, Stephanie Yang, Wang Wenxu in Taipei.